Welcome to today's webinar, Navigating Medicare for Cancer Patients Who are 65 and Over. Thank you all for joining us as we dive into this critical topic. If you or a loved one is living with a cancer or you're turning 65, navigating Medicare can seem daunting. However, understanding your options can help you make informed decisions to ensure you receive the care and the support you need. To help us answer your questions, we're thrilled to introduce Dan Weinreeb. Dan is a Buffalo native with over 15 years of experience, leading initiatives and health insurance plans across the nation. He has a wealth of knowledge in Medicare and Medicaid policies, and he has worked extensively to improve the healthcare journey for people just like you, those managing complex health conditions, including cancer. Dan is here to help shed light on Medicare options for cancer patients so you can focus on your treatment and your well-being. Dan, thank you so much for being here with us today.
Oh, it's my pleasure. Thank you for having me.
So, to get started, what are the Medicare options for someone who is 65 or older and they're currently undergoing cancer treatment?
Yeah, so, Medicare is complicated and they don't make it easy.
No.
Now add the challenges of trying to manage your health, especially if you're living with cancer. It can be even more difficult. So just the basics, right? There's Part A, which is something when you turn 65, you have access to it. Very easy to enroll and work that out. Then you start to get into the more specific ones that you actually have to contribute to, whether it's via a premium or a copay. And those are things like Medicare Part B. And also you get into the Medicare Advantage plans, which are private health insurance companies and private health insurance products that you have to also pay extra for. One of the things that I think everybody needs to really focus on when they're either turning 65 or they're going through a cancer treatment is access, right?
Yes.
Network, right? Is the hospitals covered? Are your providers in network? And also the pharmaceuticals, right? The treatments. What is needed to really manage your health and to treat the cancer that you have? Are those things covered?
Well, that's a great overview. But now cancer treatments, there's clinical trials, there's chemotherapies, there's the supplemental drugs that go with it for side effects and things like that. What should cancer patients know about costs, premiums, deductible, co-payments?
Yeah, it all gets very costly and confusing. So the co-payments for actual provider visits and facilities and skilled nursing facilities and hospitals, right? Those are things that are most likely going to be just included in your Medicare Advantage plan. There's going to be extra costs if somebody is out of network. So when you're researching which health insurance product to actually go with during that time when you're selecting your plan, you want to make sure that you're looking at what providers are in network, right? And also what drugs are covered and at what cost. That's for Part D, which is the prescription drug coverage. So all these things to think about when you're trying to manage your costs and also manage your care.
So the physicians in network, the specialists in network, the facilities in network, and your prescription, all very important. Very, very true. What cancer-related treatments and services are covered by Medicare?
Yeah, so I think, when you're taking a look at specifically just kind of cancer in general, treatments like screenings, right? Preventative screenings. Medicare is very, very generous when it comes to covering those costs, right? They want to make sure that you're getting ahead of the game, right? Now, where that second part comes into play is you've been diagnosed, right? You have that condition, you have cancer. It's going to vary by plan what specific treatments and drugs are going to be covered. So definitely things that you have to talk to your open enrollment sales representative and your health insurance company about to see, is chemotherapy going to be covered? Do I have to go into a facility to have that covered, or can things be done at home? Is there going to be transportation to and from these appointments that can support me because I might not be able to drive, right? All of those things you really need to take into account when you're taking a look at the Medicare Advantage plan.
Okay, including like the new innovative treatments that are coming and immunotherapies and surgeries, all of that needs to be questions asked.
Exactly. Clinical trials, right? The traditional treatments, you might have cancer that opens that door to you participating in a clinical trial, right? You want to give yourself the very best chance, and you don't want to have to sell your house to do it, right? So really taking a look at those plans is really important.
Well, that leads us to our next question. Is it advisable for cancer patients to consider a Medicare supplement? I think they call it a Medigap plan.
Yeah, I think you have to look at all of your options. There are resources out there like AARP, your local areas on aging here in Buffalo, New York, right? There's all kinds of resources that are available to you to figure out whether or not you should make that additional investment to cover treatments and to cover care that might not be included in traditional Medicare or even a Medicare Advantage plan. So the short answer, yes, take a look, right? Do your investigating. And there might even be your providers here in the area that would have a really great option and tell you exactly where you might need to make that investment based on the cancer that you have.
Now, generally with the Medigap plans, because Medicare would be primary and the Medigap would be secondary, so that would reduce the in and out of network issues, concerns with authorizations and things like that with delays?
Exactly. Yeah, that's an excellent point. It really does expand your access, right? And expand that coverage and that network. So you're giving yourself that opportunity to go outside of the network but not have to pay for it.
So how does the Medicare with the Medigap versus the Medicare Advantage, pros and cons?
Yeah, so in order to actually have the Medigap, you have to be enrolled in Medicare Part B, right? That is original Medicare, right?
Okay.
That's the only way you can get into that Medigap piece. Now, that really has to do with, are you going to have additional expenses, right? Is the care going to cost more than what Part B is going to cover? And that's where that Medigap comes into play, right? If you're having treatments and care that goes beyond what is covered, it's a supplement, right? It really comes in and kind of saves the day. And you don't always get that with a Medicare Advantage plan.
Well, how can patients who have cancer ensure their doctor and cancer treatments and the centers are covered by the plan that they choose? What should they do to confirm that coverage?
So I'm kind of old school in this regard, right? I like to pick up the phone and call, right? Your doctors who are providing that care to you, if you're already receiving treatment at a cancer center, ask, right? Do you take this insurance? What else am I missing in order to cover what I'm gonna have to get care for, right? So ask the questions face-to-face with the doctors if you have that opportunity. And also, you can take a look at health insurance online, or when you're enrolling in a health insurance plan during that open enrollment period, you can ask them for their directories of providers, facilities, primary care physicians, specialists, right? It should all be listed. And if you don't see your provider on there, you might really want to think about joining a different health plan.
So it sounds to me that you're saying before switching or before choosing, if you're currently with a provider or specialist, any specialist, you should talk to them before making any decisions. Is that what you're saying?
100%. Ask them first. Definitely.
So Dan, what about prescription drugs? Because we know, cancer, there can be chemotherapy and other expensive drugs. Should cancer patients consider a Medicare Part D plan?
Short answer, yes.
Okay.
I think that when you're taking a look at what health insurance you're actually going to enroll in, knowing that your medications, and it could be maintenance medications for diabetes, right? Not everything is as complex as cancer. So yes, Part D is critical when you're making that decision. Now, when you're getting treatment for cancer, chemotherapy, other medications to combat side effects, those are all things that you have to take into consideration as well. And health insurance companies have to provide you with a list of those medications that are covered and what their cost is. So again, ask, do your research, ask your providers as well, because providers are very knowledgeable in terms of what is covered and what isn't.
We've talked about Medicare Advantage a bit already, but what should cancer patients consider when choosing a Medicare Advantage program?
Yeah, I think the biggest thing is network,
Yeah.
right? Is your provider and is access to the very best possible treatment and care, is it in network? Or do you have to travel and pay extra for it? I would give this advice to my parents and grandparents as well. Take a look at the network, right? Make sure that your providers are not only in there, but also the facilities, the clinics, the hospitals are in network so that you don't have to find yourself picking up and having to travel to another state to get the care that you need, right? You can get it right here at home. Just make sure that they're in network. So when you're selecting that Medicare Advantage plan, there are really three components that you should focus in on if you have cancer.
Okay.
Your oncologists, are your oncologists in network, right? Are the cancer centers that you're going to, are they in network? And then third, and perhaps the most costly, are the pharmaceuticals, right? The drugs and the treatments that you're receiving to get yourself healthy, are they going to be covered as well? So those three are really the most important.
So, Dan, beyond the standard Medicare coverage, what additional benefits should cancer patients consider?
So there's a whole component to staying healthy that is not medical or pharmaceutical, right? There are these social care needs and services. So you also want to take a look and see if there are other benefits that are available in that health plan and in that product that are going to support your needs beyond the medical and the pharmaceutical. Things like transportation, home delivered meals, caregiving services, being able to get some extra help around the house, right? Medicare Advantage plans sometimes offer those benefits. Sometimes they don't. It really is up to them. So when you're shopping around, you should also maybe consider if there's an opportunity to get involved in a Medicare and a Medicaid plan called a dual eligible plan.
Dual plan.
A dual plan, right? Those dual plans take all of the things that are available for Medicaid, the social care components that I just talked about, and they meld them together with your Medicare plan so you have access to the clinical piece, the medical and pharmaceutical, as well as the social components that are going to help you recover and put you in the best possible scenario to get better.
Really seems like that's taking care of the whole patient.
Exactly.
Can cancer patients change their Medicare plan later if their needs change? What options do they have?
There are definitely options to switch depending on your health status, right? If you are newly diagnosed, if your condition worsens, if there are other conditions that are added on top of your underlying chronic conditions. So all of those can help qualify you and make you eligible for changing health plans outside of the window that the government has us sell within, right? So that's called a special election period, right? That is when you can go to the health plan and say, things have changed. And this health plan, this product isn't matching my needs anymore based on these new conditions or based on this progression. So definitely an opportunity to make the switch when your needs have changed.
Good information, very good information, and that's good to hear. Lastly, for those with financial concerns, what are Medicaid options for cancer patients with a low income?
Yeah, so I think Medicaid does an amazing job, especially here in New York State, for providing additional access to services and treatments. And I think, just being able to navigate that is a challenge for a lot of people, right? So they don't make it easy, right? You have to enroll yourself. You have to provide a whole bunch of documentation and paperwork and your finances, right? So getting the help that you need to get all of that in order is going to be step number one. Do you qualify? Are you eligible for those Medicaid plans and for those Medicaid benefits, in addition to maybe what you're getting on Medicare? But again, Medicaid does a really great job of providing access to additional services that Medicare might not cover or Medicare Advantage doesn't cover. So really take that second to see, do I qualify? Am I potentially eligible for a dual product where I have both Medicare and Medicaid, and you can really reap the benefits of both of them?
Dan, thank you so much for joining us. Our cancer patients are going through so much that this information really will help them during this journey. So thank you so much for joining us.
Oh, it's my pleasure. And don't forget, October 15th to December 7th, that is the selection period, right? Open enrollment. So be prepared, do your research, and find the best plan that's going to work for you. And use Roswell as a resource, right? You guys have a lot of answers, so don't be afraid to ask your providers.
Thank you. Well, thank you to everyone who's joined us today. This has been insightful. If you have further questions or you need assistance or you're thinking about changing insurances, feel free to reach out to us. We're here to help you. Remember, understanding your Medicare options can help you focus on what's most important, your health and your well-being. Stay strong, and we're here to support you on this journey.